The Institute of World Affairs at the University of Wisconsin-Milwaukee presents International Focus, a weekly discussion of the people and events behind today's global headlines. Support provided by Milwaukee Public Television and the UW-M Center for International Education. Now here's your host, Doug Savage.
Welcome to International Focus. First discovered in Uganda in the 1940s, the Zika virus was long considered to be relatively benign. As a result, for decades, little research was done by the medical community. Recently, however, scientists have established connection between Zika and several neurological birth defects, prompting public health scramble in impacted countries. Around the world, responses to this and other public health crises occur in a wider context. To help us understand both the science and the sociology of the Zika outbreak, we're joined today by Dr. Aaron Buseh, professor and director of the PhD program at the University of Wisconsin-Milwaukee's College of Nursing. A native of Liberia, his research and teaching focus on ways to address the structural causes of health disparities that can contribute to the seriousness of public health emergencies like the current Zika outbreak. We're also joined by Paul Biedrzycki, Director of Disease Control and Environmental Health for the City of Milwaukee Health Department. He oversees and manages a wide range of local health activities, including programs in communicable disease control, emerging infectious disease response, and public health emergency preparedness. Well, welcome both of you.
Thank you.
Thank you.
Well, Paul, maybe you could start. You said recently in a piece for the local paper that, quote, the Zika virus, like Ebola, represents a case study in global health security. How so?
Absolutely. I think we're in an era of emerging infectious diseases, and a lot of these begin as clusters or outbreaks overseas, literally 1,000 miles away. However, given modern mobility, especially air travel, these diseases can be on our porch overnight. So it really begs the question, how do we prepare locally for these global threats? And how we prepare locally for emerging infectious diseases needs to carry a sense of urgency that, again, when I was growing up in public health, really didn't exist. It was more concerned about what's circulating locally or maybe regionally. But now we need to look well beyond our states, well beyond our borders, into the global environment. And that's what global health security is. Really being situationally aware of events, in this case emerging infectious diseases that may be simmering or brewing far away from our own shores.
So Aaron, you have sort of two perspectives on this. You deal with our local situation, but you also have a global purview on this. So what about this? I mean, what about sort of the places where Zika first started? I mean, what can you tell us about the health systems there that impact the ability for it to break out globally?
Yeah, I think one of the first thing I'd like to say is that these vector-borne diseases, in the case of mosquitoes, are always going to be around. And they have always been around us. And so we need to stop looking at it like just a nuisance. But we need to kind of try to figure out probably how can we live together with these flies and mosquitoes. Because there's an issue of health inequality, as I look at it, between the developed and the developing countries. Many of these countries' health systems and their health infrastructures are poor. They don't have good health systems, not enough doctors and nurses, not enough testing kits. So even if we came up with testing materials for Zika, for instance, how do you test? Even if there was vaccines for Zika, how do you treat? So all of these things have to be considered and put in perspective. So what you got happening is that you have a whole global phenomenon, but you also have a local process in which, like Paul earlier said, we live in this global community. So folks are going to travel back and forth. There will be people living from these developing countries coming into the U.S. or the Western world, or people living from the West going into these developing countries. And so you have some reverse infection too taking place. And so I think if we can work together, both the developed and the developing countries, to put in place some good surveillance system and help to strengthen the health systems in these developing countries, whether it's Brazil, whether it's Ecuador, whether it's Cuba, wherever, or in Africa, for instance, then you'll be able to curtail some of these, infectious diseases.
Well, do you think there is a tendency to consider the crisis more relevant, more important when it starts to impact the wealthy West?
Of course, that's the issue there. As I said before the taping, there's always, they and us. And this whole issue is not only related to diseases alone, but even in the issue of economics. And so what you got happening here is that if it is not in my area or my environment, then I don't pay much attention to it. Or one of the provocative questions that I always ask my health policy students is that, why should we worry about healthcare of folks in far away land when we right here in Milwaukee has a lot of issues impacting us right here in Milwaukee? Why should we be concerned about that?
And I think emerging infectious diseases are increasingly becoming framed in the context of national health security, how they impact our borders, our critical infrastructure. Do they create social disruption? Do they create any political or civil unrest? And so it's not only being viewed through the lens of public health epidemiology, but on a much broader scale, that emerging infectious diseases in the context of national health security have tremendous implications for society as a whole.
So looking specifically at Zika, why now? I mean, if this was first identified in the 1940s, what prompted this current outbreak?
Well, I think there's two things, at least from a local public health perspective. One was the World Health Organization declaring Zika a public health concern or emergency of international concern. I think it was a public health emergency of international concern earlier this year. I believe it was spring. And then there was an explosion of Zika case occurrence and transmission across the southern hemisphere, particularly South America, Central America, and the Caribbean. That was unprecedented. Prior to that, we only saw small outbreaks in remote areas of the world, primarily Africa, Southeast Asia, some areas of the Pacific Island. So this got the attention of international and our national CDC, our national health officials, in a very big way. And coming on the coattails of Ebola, I think there was really pressure not to make the same mistake of blowing the horn too late or sounding the alarm too late, and really becoming very responsible in risk messaging and especially prevention or preventive measures that the public could adopt. But because it was occurring in primarily developing countries, I think, again, there was not necessarily the rapid, exponentially quick response that I would have expected even after WHO declared this a public health emergency of international concern.
Well, and certainly, go ahead.
Yeah, I think, and I would just say we, because the international health community learned from what happened with the Ebola outbreak in West Africa. So, as you said in the piece, the whole Ebola outbreak in 2014 in West Africa was an eye-opening and awakening process for the global health community. And so this time around, WHO did not want to make that same mistake of not declaring, a global emergency. One of the things, however, and I will step back from this whole process, and I think we are beginning to learn from it, but there are other health conditions that, in fact, are spread and that causes more, I would say, disability, and that cause a lot of issues, even if we stay within just the domain of mosquitoes alone. So if you take the Anopheles mosquitoes that carries malaria, that in fact causes a lot of deaths, per capita, and causes a lot of disabilities. Affects women, children, pregnant women, lose their fetuses when they get malaria. And I think one of the things I have been concerned about when I speak to audiences is that, yes, we can pay some attention to Zika, and we need to. I'm not dismissing that, but we need to also step back and figure out how can we address some of these other vector-borne diseases. I grew up, and work in a rural area, in a rural hospital, and I know what I saw. I saw pregnant women coming in, with high malaria parasites. There were high rates of Lassa fever, for instance, which is another dangerous disease, or spread by vector-borne diseases. So to me, I keep stressing the whole issue of poverty and inequality, water, sanitation, improving the living standard of people in those areas. So when the outbreak started, in Brazil, the Zika outbreak, you have issues of people living in the slums with no kind of screen to their windows or to their doors. So to me, I would say, well, is there a way to lift those people away from those areas, improve their living standard? I'm sure folks who live in some of those wealthy suburbs in Brazil and other places may not get bitten by mosquitoes because they don't have stagnant water to contend with.
Well, what about that? I mean, there's a whole raft of disease known as sort of diseases of poverty. I mean, what is that about?
Yeah, I really think Aaron brought up some very interesting points about, in this case, emerging infectious diseases like Ebola and Zika. What's most concerning to public health are diseases in which there is universal susceptibility, severe outcomes for the general population or subpopulation, and the lack of medical countermeasures. And I would say, fourthly, the ability to control easily, and some of that is due to disparities in socioeconomic status. And we do see large disparities across almost all communicable diseases, even in this community, when you begin to slice and dice the data by social determinants of health. Socioeconomic status, socioeducational status, and race, for example, are three that I can, again, point out as being disparate in terms of their impact in this community for even general reportable diseases, whether you look at measles, whether you look at salmonella outbreaks, foodborne or waterborne outbreaks. And a lot of that has to do with the ability for populations to assimilate information, become aware, and take control, have the assets or ability to really control disease spread and occurrence. And again, it's clearly cut along lines of poverty. The ability to the access and availability of information, the access and availability of health care, including treatment, the access and availability to alternatives to, again, controlling disease. In this case with Zika, repairing screens and doors or implementing mosquito control at the property level. Again, that becomes a very, very important consideration outside of even the basic epidemiologic approach to disease in a community.
So just sort of structurally as governments, as public policy apparatus, is there enough interaction between people formally and narrowly charged with public health and people who take care of the kinds of issues that contribute to these kinds of outbreaks? I mean, if screens are a big issue, your doctor is not going to put a screen on your house.
Absolutely.
Yeah, absolutely. And so for me, I view many of these diseases through the lens of, I would say, social and environmental justice. So I mean, this is the bottom line. You got social and environmental justice issues taking place here. And so, however, you have to understand that when you look at population dynamics, whether in developing countries or the U.S., many of the people that are mostly affected by these conditions are not viewed as major constituents for politicians. And when in that kind of perspective, then do you think there'll be some investment in that area? No, we wait until things begins to become very bad in that area, and then when it begins to spill over, and you have this whole spillover effect, whether it's violence, whatever the case is, like, then before we try to react. And I hate to mention the whole issue of Cuba, but Cuba is doing a very nice job in addressing the Zika epidemic. They have put in place some proactive stance, and it's going all in the slums and everywhere else, doing all the fumigation, making sure to do a lot of spraying, they test, they do everything. But then they link these folks back into a health center. They even go on testing for temperatures and everything else to make sure that you don't have any fever. Anybody has fever in there, let's get them into the door. But if you got a health system in the U.S., for instance, that is based on basically insurance. So there was a story of a gentleman who I think came back recently, and I've forgotten where, but didn't feel good and kind of said, well, maybe I have Zika, or I got business stuff. Well, he went to some facility and they told him, well, we want to test women or something like that. All right, that's not in Milwaukee, but he said, we want to test women. Well, you have to put in place a structure that will be able to test everybody and be able to get them into treatment early. So I like the idea that he's proposing. And I'm one of those persons who think that you cannot have many of these programs designed to have this top-down approach. So you have to give the benefit and give the whole process to the Milwaukee Health Department to be able to put in place their only mechanism on how they can better address that at the city level, And if you do that, that would be much better. Let the federal government give some funding, to the health departments to be able to do that kind of stuff.
And I think Aaron brought up another very key point. Policymakers, by nature, tend to be very reactive, and no different when it comes to a public health emergency, not thinking ahead to the core precept of prevention, which is the foundation of public health.
Yeah.
So at the City of Milwaukee Health Department, we're big advocates of public health in all policies, bringing public health to the table often and early across a wide range of economic, social, and political decision-making or strategic planning. That would go a long way. Prevention is far more cost-effective. It allows us to identify innovative and creative solutions up front before we're in the battle mode or the reaction mode, because that tends to be very difficult in terms of just resource allocation, equitable resource allocation, as well as effective control, in this case, of disease.
Well, we're going to talk a little bit about sort of the post-outbreak sociological impacts after that, but first we'll take a short break. We'll be right back.
The Institute of World Affairs presents our community with a range of public programs relating to global issues, U.S. foreign policy, and the world economy. For more information about the Institute of World Affairs, call 414-229-3220 or visit our website at www.iwa.uwm.edu.
Welcome back. We're discussing Zika and related health policy with Aaron Buseh and Paul Biedrzycki. So before the break, we touched a little bit on the sort of the socioeconomic priorities outbreaks are given. Yeah. Do we find that in this country as well, do you think? I mean, certainly it's very easy for the wealthy West to not be terribly concerned if it's far away and it's people who really have been marginalized in other ways. We find the same thing in our society?
I mean, unfortunately, I think we do here in the U.S. And I see most of the outbreaks that get the biggest attention are those that have immediate impact either on the economy, corporate America, or, again, individuals that, again, can afford to go to healthcare, get some treatment, or take control. And that's unfortunate. When we deal with involuntary risks, including vector-borne diseases or water quality exposure, air quality exposure, I think we need to look across the broad spectrum of the population in ways that I don't think our policy is currently calibrated.
Yeah. So again, I think I earlier on said that the health system in the United States is structured around, health insurance. And, even with the Affordable Care Act, you have more people coming into the system. And so that's a good thing. However, there's a whole host of other factors that comes into play that makes people to go and seek health care, so there's a whole issue of access and utilization. But I think, time and time again, policies are passed both in the United States and abroad, but more so even in the United States on a piecemeal basis. So we're going to take care of Medicare Part D, and take care of that one. We'll take care of the children's health insurance, and that doesn't really address everything that needs to be done. I think we have to understand too and build bridges even within the U.S. between communities and begin to help communities empower themselves to be able to be healthy. So there's this whole push for healthy communities, and appreciate, sharing the panel with Paul, because the Milwaukee Health Department does phenomenal work at the grassroots levels and getting out in the community to address issues around infant mortality rate. The infant mortality rate in Milwaukee is going down, and one of the reasons why it's going down is because of the work that the Milwaukee Health Department has been doing in all of these local communities. Is that grandmother and those folks on the block who is going to look at that teenager and say, have you gone in for your prenatal care today, or have you gone in for your checkup today? So you have to support those types of efforts that are being done in the local communities.
Right. I think authentic engagement of the community is incredibly important, this genuine engagement of the community that starts with listening, bringing them to the table, understanding again from their perspective their current situation. So with Zika, for example, we know that this mosquito-borne disease needs to be controlled at the property level, not the community-wide level, which means we need to really get into the weeds with the community to begin to, again, to change the course or trajectory of the disease if indeed it continues to appear or reappears in the coming years. It really requires a different model of community engagement that I think government is typically not comfortable with.
Yeah. Let's talk a little bit about something particular to Zika, and that's where the funding at the U.S. federal level has run afoul, and what are some of the issues there?
Yeah. Well, passing legislation at the federal level is complex. It's a complex process. You got two houses, and then you have the executive branch. And as you are aware, we are in an election year. And so with elections, around the corner, of course, politics, in fact, even is ratcheted up, and it seeps in. The process, however, is that I think one of the strategies is for us as the population to continue to tell the folks in Congress not to play politics with our health. And one of the things I tend to do with my students, especially my PhD students, is to teach them, in fact, how to do some good policy briefs and how to write policy letters to their Congress people and say, hey, you know what? I'm seeing that there is a legislation on the docket for Zika funding that the president submitted, but I'm seeing that you are one of those who is not trying to vote for this stuff, and I want you to pay some attention to it. And please, when it comes to the floor, I want you to vote for it. So we can do that. But this is one country where we are able to do that. So that's the plus. In many other countries, developing countries, where you have these dictatorships and poor governments, you don't have that. You can't write a letter. In fact, if you write a letter, you probably get arrested, for writing a letter to one of those guys. But that's a good thing, yeah. So I think we need to get the community to kind of pay some attention to. I know we are all busy. Everybody's paying attention to their families. Everybody's running. It's a rat race, but it affects everyone.
Right. And I think after Ebola, I think there is some public skepticism about these types of diseases reaching our shore and having a significant impact. So I think a lot of Congress members and the constituency see this as a remote risk, nowhere near the severity, affecting a very small sliver or slice of the population, in this case, some pregnant women. Mm-hmm. When indeed, again, there's much that's not known about the virus. It has made it to our shores already, as evidenced by the Miami-Dade outbreaks. Yeah. Most likely we'll continue to see other outbreaks or clusters in the coming years. And now we're understanding that its transmission is not just limited to mosquito-borne. We're seeing that sexual transmission is likely more significant than we thought. Yeah. There's always the risk from blood transfusion and, of course, from pregnant women unaware of infection passing it on to their newborn infants.
Yeah, but I would then, and that's fascinating you mentioned that, for me, I tend to say that when there is a lower rate of a disease, that's not the time to be complacent. In fact, that's the time to even praise the efforts of public health and to praise the effort of what folks are doing to be able to contain the disease. And the whole notion, but that's what is happening now in Congress, the notion of trying to take dollars away from the Ebola research that is going on around the country and NIH and around the country to use in addressing the Zika epidemic, to me, is ridiculous. Why would you want to do that? There may be, and there is likely to be, another Ebola outbreak. So don't you want to continue moving that science ahead and keep moving that research ahead instead of, saying, let's just siphon off some money? So yeah, he touches on an important point that that may be some of the issue that may be happening.
Well, we've got less than a minute left, Paul, but how much is that effect of sort of the disease of the hour? I mean, whatever is in the headlines is what captures the attention and the funding.
Unfortunately, it's a lot of it. I think how the media covers, again, the emergence of this disease plays a big role in the challenges that we face in controlling it. And I think with the example of Congress, I think they're exercising a lack of strategic foresight and thinking about prevention now rather than reaction later. So, and the media plays into this as well. Yeah. I do think this is a very legitimate threat to national health security, to global health security. There's much we don't know about this virus. It has a very significant impact, we know, on pregnant women. We don't fully understand the breadth of modes of transmission or long-term chronic sequelae associated with this disease. Now that is the time to act and set up that, again, foundation and infrastructure for the next disease around the corner.
Well, we'll have to leave it at there. Paul Biedrzycki, Aaron Buseh, thank you very much.
Thank you.
To our viewers, we'll see you next time on International Focus.
For information about the Institute of World Affairs and its many programs, or to become a member of the Institute, call 414-229-3220 or visit us at our website.